Earlier this year, Ithaca Mayor Savante Myrick made national headlines for wanting the first supervised injection facility in America. Now he's gained support from the New York Academy of Family Physicians. WENY's Logan Wilson joins us now to explain why doctors are urging the state to allow supervised injection facilities. Logan.
Renata, supervised injection facilities are one part of Mayor Myrick's Ithaca drug plan, and health officials say injection facilities could be a successful medical approach at tackling the area's ongoing drug issue. However, I spoke with other industry officials who say this method may not work for everyone.
It's a method, it's a mode of helping people move out of their drug addiction and into treatment.
Dr. Claypack is the Tompkins County Medical Director, as well as the 2016 New York Family Physician of the Year. He and his fellow physicians voted this year to urge the New York State Department of Health to create a pilot supervised injection facility. Citing the success of 66 injection facilities across the world, with the longest one running for 23 years.
All of them have found a way to shift from a law enforcement model to a medical treatment model. And all of them have found that it has improved their infectious disease issues and that it has provided a route for some people to move away from opioid dependency.
Specifically, Ithaca Mayor Savante Myrick touts the success of Canada's supervised injection facility called Insight. He and other members of the Ithaca drug plan toured the facility earlier this year.
I talked to business owners near their supervised injection facility. I talked to the Vancouver Police Department. We talked to people on the street and just asked them, how have things changed since you opened supervised injection? And they all told us to a person, there's less crime, there's less graffiti, there's fewer people shooting up in the streets, there's fewer needles in the bathrooms, and fewer people are dying. It actually saves lives and helps get people into treatment.
One study found a 30% increase in the use of detox services among Insight clients. Another study found the fatal overdose rate in the area surrounding Insight decreased by 35% since it opened in 2003.
Their results are frankly astounding. The number of deaths just plummet and the recovery rate increases dramatically. So we would love to see those same results from a supervised injection facility here.
However, not everyone supports Mayor Myrick's plan, and he's received pushback on his unconventional idea. Charles Adam is a recovering drug addict and the CEO of the Bradford Recovery Center in Millerton. He thinks supervised injection facilities can work if the data shows their success, but he says he doesn't think they would have worked for him during his recovery process.
That's not the type of recovery that worked for me. You know, I got sober through quality treatment, outpatient therapy, and a 12-step fellowship. That's how I got sober.
Adams opened the Bradford Recovery Center in August of this year. The Recovery Center offers residential treatment, a medical detox program, and a family program, with a focus on encouraging a network of help for the person in recovery.
I think what we've really tried to do here in Bradford County and the surrounding counties is provide as much community education as possible so that people really understand that addiction is a disease and that these aren't just bad people getting high.
The center offers services tailored to each person's experience with addiction. However, both Adams and Dr. Claypack can agree.
All care needs to be truly individualized. That means that not every single thing will work for every single person.
We need multiple ways to appeal to people, multiple ways to get them into treatment, multiple types of treatment, because not one thing works for everybody.
Dr. Claypack and Mayor Myrick say supervised injection facilities are a new approach at tackling the heroin and opioid epidemic.
That this is a medical problem and that the supervised injection facilities are sensible, do have data behind them to support them, and should be part of the thought process in solving it.
Right now, Mayor Myrick is working on getting support from lawmakers across the state before he can move forward with supervised injection facilities. Reporting in the studio, Logan Wilson, WENY News.